Hello, hi, it's Dr. Erica. Thank you for joining me on this live chat. I am here to talk about Niaspan ER. Niaspan ER is a vitamin and it also helps reduce cholesterol lowering. It is a product that, hello, this is a product that actually works by lowering the cholesterol overall, increasing good cholesterol, reduce the effect of myocardial infarction, which helps to reduce the chances of fatality, helps to reduce clogging of arteries and coronary artery as well. It's available in 3 different strengths in the ER form. It's also available as IR form as well, reduces the risk of recurrent myocardial infarction, and it also helps in patients who have pancreatitis and very increased high um, triglycerides and who have modified their diets but have not reached a successful level. And also, when taken with resins, this medication can also further benefit that particular group of patients. Now, the ultimate goal when taking niaspan is to reduce cholesterol. Although it is a vitamin, there are benefits that show that it does reduce cholesterol ultimately. So that is what we're talking about in this particular video, a niaspan ER and its effect on lowering cholesterol. Okay, and again, it can be taken with resins or also bile sequestrants, which helps to reduce cholesterol as well. They should be taken 4 hours apart from each other just because the bile acid sequestrant can affect the absorption of niaspan. So when taken consecutively but at different time frames, they can ultimately help with that. So do keep that in mind. Now, niaspan is mainly metabolized in the liver and it is excreted. Its drugs interaction again is with resins or bile acid sequestrants, which is its partner in helping reduce cholesterol. So take again those 4 hours apart. Also, it helps with postural. It causes postural hypotension. Again, when taken with uh, particular medications that affect the blood pressure, and it is contraindicated in patients who have liver dysfunction, patients who have active peptic ulcer disease, but used in caution when patients who are not with active peptic ulcer disease. So be aware of that. And also the IR form of niaspan and the ER form of niaspan should not be used interchangeably. Again, avoid using those interchangeably. They are not equivalent, so do not do that. And that is specifically for patients who are being switched from one medication to another. Again, niaspan IR and niaspan ER are not equivalent and should not be switched together. Now, patients who are alcohol users, it is actually advised by healthcare providers that this medication is not used with alcohol at all. So avoid use if possible at all costs. And patients who have a history of liver disease, patients who have jaundice or yellowing of the liver, those who have a history of peptic ulcer disease again, and those who are diabetic, and those who have a history of myocardial infarction or those who are predisposed to gout should also use this medication with caution. Just be on the lookout if you are one of those patients or know of a patient that is. Do use caution with this particular medication. So pharmacists, we do review medications before dispensing. That is part of our objective. And we do clinical review. We do counseling as well to let patients know about these drug interactions and cautions before they begin to take the medication. Okay, so some of the adverse effects is going to be decrease in phosphorus levels, increase in prothrombin time. So if you're using warfarin or Coumadin products, or if you're on an anticoagulant or antiplatelets medication, or maybe hospitalized or going to have surgery, do be aware that niaspan does have effect on those entities. And that's the prothrombin time and phosphorus levels. Now, again, it does cause flushing 88% of the time. So 88% out of 100 patients, 88 out of 100 patients will experience flushing effect. So do be aware of that. Also, rash, running nose, headache, abdominal pain, and also pruritus as well, which are less frequent, but they do occur. And also dyspepsia. So if you have a history of peptic ulcer disease or you currently have active peptic ulcer disease, be aware of this medication and its side effect, okay? Now you want to take it again at bedtime with a fatty snack such as a bag of greasy chips. I wouldn't say something like that, but do take it with a snack, at least a snack. Avoid taking it on an empty stomach if possible. And then after 4 weeks, your doctor will usually titrate you to the next available dosing to reach the recommended amount so that the full effect of cholesterol lowering can be experienced. Okay. And also is recommended that patients choose a healthy diet that is full of nutrition, protein, fiber, non-starchy vegetables, green leafy vegetables. Also, patients should consume plenty of water and also get plenty of exercise, which is going to include your weight bearing exercises as well as your moderate intense exercises such as walking, swimming, increasing blood pressure to 70 to 80% of the max heart rate. So do be aware of that. Also, avoid alcohol, and this particular medication does cause a fever and myopathy. Myopathy is defined as the pain or irritation of muscles, and so muscle tears, muscle strain, things like that of pertaining to the muscle effects can occur when taking niacin, so do be aware. Also, it's recommended to take aspirin or an NSAID right before bedtime, right before taking niacin to reduce the effect of flushing. Okay, so do be aware of that. If you're on niacin or if you've taken niacin before, you may recognize some of these recommendations. And ultimately, again, its effect is to lower the cholesterol and effect of heart attacks, the risk of heart attacks. Okay, and it can be taken with bile acid sequestrants and resins to help with that. So do be aware of that as well. If you are a cholesterol patient and you have tried the rosuvastatin cholesterol medications, the statin class of medications, your doctor may consider niaspan thereafter, but usually niaspan is given to patients who have other risks as well, such as the pancreatitis, those who also have a history of coronary artery disease. Those particular patients will be placed on this medications rather than on a class out of the statin family. So do be aware of that. And I thank you for joining me again for this particular video. Another name for niacin or niacin is going to be nicotinic acid. Nicotinic acid, you may see that as well in the marketplace. So do be on the lookout for that. And you might see niacin in the vitamins section as well. Before taking niacin as a vitamin, do ask your healthcare provider first before picking up a bottle of niacin because of its effect on um, the lipids. You want to be sure that it's okay to start a bottle of niacin. Just because it's a vitamin doesn't always mean that we recommend that you pick it up and take it. So do be on the lookout and know that niacin is also a vitamin, but that doesn't always mean that it's a good vitamin to go ahead and start without consulting a healthcare provider, such as a pharmacist who can check your list of medications and also decide whether niacin is not interacting with other medications you might be on. Now, if you're not on any other medications, niacin might be okay to go ahead and start taking, but do make sure that it's okay by asking a healthcare provider first. Okay, so that's my recommendation. That's my advice as a pharmacist. I've been a pharmacist, pharmd, for close to 10 years now. That's my specialty. I work independently for myself on YouTube, and also I have my website, themillenniumpharmacy.com. So do visit those as well to learn more. And also please subscribe to this channel. There's a little subscribe button right there in the corner that you see. Hit that subscribe button, be in the know, get more information, more content. As new content is available, I do place that on my website or on YouTube platform. Also visit me on Twitter and on TikTok. I do vlogging as well, my personal experience throughout my life and my experience with medications personally and cosmetics. So I do give some information that is pertinent and I think is very important to share. Please visit my website as well. There are lots of products and things that you can visit and decide to purchase, such as merchandise, t-shirts also, and there's medications, over-the-counter medications, hygiene products as well, and also there are medical devices. I sell medical equipment that is pertinent um, for for mobility, for eating, for dietary assistance as well. There are pill boxes, things like that that I have for sale, pill cutters, little accessories to help with your medication regimen, help keep you compliant with your medications, help you keep on track with taking your medications as prescribed. And also, if you have any questions or comments, please do not hesitate to leave them in the comment section as well, and I'll be happy to get back with you. Okay, so thank you for joining me and look to hear from me on the next video. Thank you. Bye-bye.